Start.
Hello, this is Dr. Trivedi. May I confirm that I'm talking to Mr. Bradley Cooper, 75 years old son?
Yes, doctor.
Yes. Uh, well, actually, I'm going to. I heard that actually you want to talk to me from our
Yes, doctor.
start.
Yes, doctor.
So
I just came to know over phone from your hospital that they said that my father's condition isn't good, and he has been admitted to this hospital. I was far away from this, so I come here hurriedly. Actually, what happened to him, doctor? Can you please tell me? I'm really worried about him.
yes. Before we start our conversation in detail, may I know that how far do you know about your father's condition?
Actually, doctor, over phone I was told by my sister that my father had chest pain, and he has been diagnosed with a condition called heart attack, and for that he needed admission, and also said that his heart condition isn't good. So
Yeah.
actually, how he is now?
Yes, yes, I can get it, and actually, I'm very sorry to say that uh, actually he was admitted yesterday, and we made a diagnosis of him. The diagnosis was a heart attack, and which is called MI, myocardial infarction or a heart attack. And we have we had started the best possible treatment that was available, but I'm sorry to say that in spite of giving the best treatment, actually I'm very sorry to say that your father died.
Right? What are you talking about, doctor? He has that heart attack, and I saw a lot of people surviving with heart attack. Are you sure that you are talking about my father?
Uh, I can understand. Actually, I'm very sorry to say, but we have checked and double checked the facts, and yes, I'm very sorry to say that I'm talking about your father, and he he couldn't survive. He died, actually.
Okay. How this can be happened? It's not to
Yeah.
my mind, doctor. I last day when I saw him last, he was totally fine. Within such a short of time, he's died. How it can be, doctor? Actually, what happened to him, doctor? Can you tell me exactly what happened to him?
Yes. I'm very sorry. Sorry to tell you this news. Well, would you want to know more now at this moment, or do you think that you need some break?
No, doctor. I want to know just right now because I heard many people with heart attack. They have even living quite well. Are you sure that my father died of heart attack? What happened to him? I didn't get any news about him.
Yes, I can get it, and I'm very sorry. Actually, what you heard is not false. It's actually true that many people uh, can survive heart attack very well, and even after heart attack, many people can live a very good life also. But it is also true that many people also cannot survive this severe heart attack, and that's what the case with your father actually. Actually, after getting admitted, we gave him the highest possible medication,
Okay,
including
doctor, you are
some.
saying that you have treated him well. Then why he has died?
Yes, I can get it, and actually, sometimes there can be some causes behind it. Okay, uh, when a person has heart attack, and when we give treatment, there are several possibilities. Uh, would you like to be with us? Would you like to listen more? Actually,
Yes, doctor, I really want to know. why
Yes.
this is happening to him.
Yes, actually, when this heart attack occurs, when there is some narrowing of the blood channels, okay, of the heart.
Okay, doctor, I get
So
it.
that the channels could be thinned up, okay. But when this type of attack occurs, there can be several problems, or some people just get well after getting this medication. This is one thing. Or again, some patients uh, still don't recover from this type of attack. There can be several causes behind it. Some people, in some people, that assault of the heart during the attack can be so great that even after giving treatment, the heart cannot work well. And in some people, the heart actually has some wiring mechanism so that it supplies the blood to the body in beats. Sometimes the wiring mechanism can also get severely affected, okay, because of this heart attack. And in these type of conditions, we tell that there is cardiac arrest. I'm afraid to say that actually this is what we think happened to your father.
Isn't there
Just
any treatment for that, doctor?
and Yes, I'm very. I can understand your condition now. There is actually some very emergency treatment, although this treatment cannot assure or cannot guarantee the patient's life, but there is some treatment, and we assure you that we actually made all attempts to revive him again after that event. Okay, so but despite giving all making all attempts, I am sorry to say that we could not save.
What did you do, doctor? Can you tell me exactly what did you do?
Well, actually, we actually at the time we gave him some emergency oxygen, and also gave helped him uh, to do some breathing to maintain his breathing by some breathing machine, and we also gave him some other medications as well. We tried with all these things, and even when he had this, we very importantly, we the main treatment is actually giving him helping him to again recycle the heart by giving him some chest compressions. We also tried with that. That is called CPR. Actually, we also gave him that. But I'm sorry to say that we couldn't save him even after all those things. Are you getting me?
Okay, doctor. So you told me that you have gave him CPR, and I saw on the television that giving CPR makes him, the person. Even I saw on the TV that there were some person who were about 5 minutes unconscious, and after giving that CPR, they came back to life. And you were admitted into my father was admitted into this hospital, and you were monitoring him. Why is there any fault that you couldn't do it earlier? Or are you just hiding anything from me?
Doctor, uh, I'm at this moment. I would like. I can understand your condition. It's a very difficult condition for you, but I can assure you that we have tried our level best with all the treatment facilities that we have, uh, and at this moment, we actually don't think that there might be any problems or any shortcomings in our attempt. But yet again, we in these type of cases we actually review again our medication and our total management to find out if whether there was any mishap or any problem, anything more could be done. But at this moment, we have done it, and we actually did the CPR and also other medication for quite a long time, and our consultants were present also. and they also checked and rechecked your father. Okay, and despite all these things, he couldn't survive actually.
Okay, doctor. I have many relatives. They had this heart attack, but they survived. And even some of them were admitted to the ICU. Couldn't you do that for him?
uh, well, actually, at the very first minute, the very first second when uh, this heart attack, when this cardiac arrest occurred, he was already in our CCU. Okay, so he was already getting that treatment, and at that moment we were very much cautious about his treatment, and we started treatment immediately. We didn't waste any time. Okay, and so there was at that moment not any necessity to shift him to ICU again. And at that moment, all those equipments were present, so that could have helped him. And we tried with all those equipments actually.
Okay, I can understand. And whatever you are taking, I have to believe that.
I can understand. I can understand it, but may I know that actually, is there anything more that actually you want to
Yes, doctor.
know?
Are you sure that he had you are telling that cardiac arrest?
Well, actually, we are at this moment quite sure about it. But if you want to know more or want to be more sure, I think we might go for some testing. Like
Meaning,
we might go for some testing if you want, if you allow. There is called a hospital postmortem, but you
no,
can
doctor,
think.
I will never I will never permit that.
Yes,
Can you just leave him
yeah. It's
now?
all right. It's all right. It's all right. uh, we can actually, we will try to complete all the necessary formalities in the shortest possible time. If you want to uh, if you want to make arrangements for your brothers, for your father's funeral or something like that. uh, are you getting me?
Okay, doctor.
Yes, at this moment, may I know something more from you?
Okay.
uh, well, do you think that we can help you in any way, in any at this moment, in any financial way, or do you need any religious service or social services for your father, do you think?
Yes, doctor. That is another thing. My father was a very religious person, and I think
Okay,
you can manage anything for him for the peace
okay.
of his soul.
Yeah, we will immediately call our social services so that they can help in this case as soon as possible. Will it be all right?
Okay, doctor.
Okay, and anything more that you would like to know or you would want from us, can we know of it?
No, doctor. We just want to take him.
Okay, yes, and may I know that do you have enough equipments or enough arrangements to take him now after we complete the formalities, or do you need any vehicles or something so that you can
Time
take
up.
him? Okay.
So, do you need a minute or you can start now?
I think we can. I think I can start now.
Okay. Can you please tell me that what was your task?
My task was to talk to him, explain the condition, and tell him that his father has died.
Okay. And can you please tell me that what was the scenario?
The scenario was badly. Yesterday, the patient was admitted yesterday, and diagnosis of acute MI was made. But this morning, there was sudden cardiac arrest, and despite attempting to revive him, the attempt was unsuccessful, and he died shortly after cardiac arrest.
And what do you think that you could convince the patient's son?
I'm not sure, but I think he somehow complied by my explanation at last.
And was there anything that you should have or you could have explained or explored if you had time?
Uh, I I cannot remember, doctor.
Okay. So you're going for the case discussion, okay?
Okay.
First, your task was that this gentleman was admitted to the cardiology ward yesterday and was diagnosed to have acute myocardial infarction 2 days. Morning, suddenly he developed cardiac arrest and attempts to revive him was unsuccessful. He died shortly after cardiac arrest.
Mm, mm,
Okay.
mm.
Okay. So can you tell me at this point what do you mean by cardiac arrest?
Cardiac arrest means I think this can be asystole at this patient.
Okay. And when you were talking to the patient's son, you introduced yourself well. You confirmed his son's identity and also confirmed that however he knows about his father's condition. That was fine.
Mm,
Okay.
mm,
After that, you told that yes, your father has died. That was quite straightforward. That was fine. Before telling that your father had been admitted to the hospital yesterday with heart
mm,
attack, and this morning his condition got worsened and he died. I am sorry to tell you that.
mm,
Okay, that was fine.
mm, 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 mm,
That I didn't accept it, and I told you that it could be another person. Then you again explained that this is unlikely because you have double set the identity.
mm,
That was fine. And after that, I wanted to know that actually what happened to him. Your task was to explain the condition, that means cardiac arrest. And I actually, truly speaking, I couldn't understand anything. What did you mean by cardiac arrest?
mm, mm.
Okay.
Yes.
You could have told like this that yes, I am extremely sorry for your loss, and to explain this, can I explain it to you in details? Okay. Then okay, our heart
Mm,
all time beats. Okay, it
mm,
moves so that it can circulate blood through our body, and suddenly it had stopped moving, stopped working. We
mm,
call
mm, mm.
that condition a cardiac arrest.
Okay.
Okay,
Mm,
and to again start working of this heart,
mm,
we need to we started some treatment for that. Okay,
mm,
but I am sorry to tell you
mm,
that that didn't work for him.
mm, 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 mm,
Then I could say, okay, why he had developed this under your supervision. Okay, there are lots of causes that can happen, but at this time, as your father has a heart attack, that can also cause this heart
mm,
stopped working. And you were saying the cardiac arrest
mm, mm,
repeatedly. Cardiac arrest is an is a jargon. It's a
mm, mm, mm,
medical word. I didn't say at that time that what do you mean by cardiac arrest? You are saying I just
mm,
keep that, but you have repeatedly you are repeatedly saying that.
mm,
So
mm,
you
mm,
can say that okay, heart stopped working, heart didn't work, so that I understand.
mm, mm, mm.
Okay,
Yeah.
and you are explaining myocardial infarction. I think that was not necessary.
Okay.
Otherwise, I have asked that what happened to him. Then you could have explained me
Mm,
that what do you mean by myocardial infarction or heart attack.
mm, mm, mm,
Task was to explain him cardiac arrest, and you hadn't explained this in a well manner. Okay, and after
okay.
that, explaining the cardiac arrest, what could have been done? Okay, what could have been done? There are certain medication some chest compression, electrical shock. Okay, and
mm,
our team is very expert, and uh, we have tried all our level best to do this, but
mm,
I'm sorry to tell you that his condition
mm,
didn't improve with this.
mm, mm, mm,
Okay, after
mm,
that, I could have understood, and within a short time, you could have convinced me. At that time, I could
yeah,
say another thing that okay, I saw a lot of events on the television. They are
mm,
surviving. I have
mm,
one of my few relatives. They have also survived this heart attack. Why didn't he? At that point, okay. So there are lots of factors,
mm, mm,
aging. There are
mm,
certain other factors, and your father's heart condition. We cannot exactly tell you that how was his heart condition at that point, and the heart
mm,
couldn't bear this such assault or such heart attack, so that it couldn't be revived again.
mm.
Okay.
Sorry, can you just add this line again? I couldn't get it.
Okay, there are certain factors that can cause this. There are
Age.
the age, and there are other certain factor, and also the heart attack itself. This was this can be
Mm,
sometimes so serious that heart cannot revive itself.
mm, 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 mm.
Okay,
Okay.
and we tried our
Mm,
best. Okay, I have seen on the TV. Okay, I can understand that you have
mm.
a good knowledge on that. Actually, this is not happened to all the people. Only
Yeah, yeah,
whoever develops this type of heart uh, stopped working, and some only few of them survive after this. Actually,
yeah, yeah.
this is a bad condition, but we tried our level best.
Mm, 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 mm,
Okay,
mm, mm.
tell
Yes.
you should have told me that okay, CPR is only it is a about 10 to I cannot remember, but I think that only 10% people survive with CPR. That's a very little amount. I cannot remember exactly. And also the cause, there are lots of causes.
Yeah, yeah.
Okay, and after that, okay, then you could have told, according to my question, that okay, what are you going to do? Couldn't you do anything that he had heart attack? So couldn't you do anything before that he have possibility of developing this?
Yeah.
At that time, okay, actually I can understand your condition. You are really upset, or you're really very uh,
Mm,
depressed at this time, and this is actually happens. And I am sorry again, sorry for your loss. I can understand your question. I can understand your concern, but actually we have always in our ward we always put our patients under regular checkup, regular
mm,
follow up, regular machine checkup.
mm,
So
mm.
if any condition, and we are always present here, if any condition appears, we always take immediate care for that. Okay, and it is not certain that every people with this condition will develop this type of attack.
Mm,
Some of them
mm.
develops attack, and I am sorry to say that in father's case it has happened.
Okay, the question was what did he ask? That whether could you have done more?
Could you have done anything that his my father has a heart attack, and couldn't you do anything to prevent this type of stop working the heart, to stop working the heart?
So, what should have I answered? I have told everything again. So, this
Okay,
follow up.
actually we are keeping our patients on the what called on the machine for follow up, and we regularly check and if few patient develop this type of condition, and it is not certain that who will develop this condition and who will not. But please be assured that we always keep them under machine checkup, under machine follow up. We regularly uh, visit them, and we always present there. If
Mm,
anyone develops any certain condition, we always take care of that.
okay, okay.
Okay, and overall this was fine. Just one thing that you have explained myocardial infarction that was not necessary, but telling about the cardiac arrest in a good way that was necessary. That our
Yeah.
heart beats, heart moves, heart contracts and relax. Okay,
Mm-hmm.
so that it supplies body to our, it supplies blood to our body. But the heart suddenly stopped working, so it wouldn't supply the blood.
Mm-hmm.
Okay,
Yeah.
and we tried our level best to start its work again, but it didn't happen. Okay,
Yeah. Yeah. Okay.
do you want to add anything?
No, I don't want to add anything at this
Okay,
moment.
then I am stopping.